This film is about bowel screening for people with a learning disability.
Hi, I'm Hilary Gardner and I'm the Strategic Liaison Nurse for Learning Disabilities in Hertfordshire, and today I want to talk about bowel screening and why it's important to complete the bowel screening if you get sent it. It looks like this. So I'm with today Megan, and Megan, you are our Health Equalities Nurse, and that means your job is around all the 3 cancer screenings and helping people with learning disabilities make sure that they attend or complete cancer screenings. Yes. So with bowel screening, can you tell us a bit about why bowel screening is important?
So we get invited to bowel screening. Every person in England will be invited to bowel screening when they turn 60 years old if they're registered with a GP surgery. They will receive this in the post.
Okay.
And it's to look for signs of bowel cancer and signs of changes in the bowel that may indicate that there's a concern there. So
when you say concern, what do you mean?
So maybe that there's something like polyps, which are little growths in our bowels, that could turn cancerous if they are left. They're not cancerous to begin with, but if they are left untreated, they may turn cancerous.
So they're looking, by doing this screening, they're looking for things in your bowels that could become cancerous if they don't get found.
Yes.
So it's a screening to try and stop you even reaching the point of getting bowel cancer.
Yes,
right,
absolutely.
Excellent. Okay.
So this kit will come in the post. It will include a letter.
Okay.
And some instructions on how to use the kit.
Right, yeah, across the top there.
So in this kit there is a sample pot.
Right.
That is used to collect the sample of poo.
Okay, so it's a poo sample. When we're talking
sample.
about bowels,
yes.
When we eat our dinner, it goes through our stomach and then, it goes through all our guts and comes out as a poo, and the bowel is our guts that the poo forms in, isn't it?
Yeah.
And then we poo it out, and then we have to take a little sample of poo.
You just take a little swipe along the poo with this, pop it back in the pot, send it off in the post. And that's it. And then every 2 years, you'll be invited for this, you'll be sent again.
Right.
You'll get a letter back from the NHS, will either say no further tests needed, or it may be that there's further tests needed, which would then, you'd get a letter for an appointment.
Okay, so at this point, all we need to worry about is getting this sample.
Yes.
And then if there's more things needed, we can worry about that later.
Yes.
But at the moment, we're just looking at how to get this sample. Now, some people are going to say, oh, I don't want to do that. That's all about poo. Why do you say it's important?
It's important because bowel cancer is the 4th most common cancer in the UK.
Right.
And it's important to catch the signs early before it becomes something that's harder to treat.
And if it's left, if you did get bowel cancer and it wasn't treated, can you die from it?
Yes, you can die from it.
Right, so bowel cancer is one of the biggest killers.
Yeah.
So we don't want to die young,
no.
Just because we're a bit embarrassed about taking a bit of poo, do we?
Absolutely, and everybody
right.
poos. So
yeah, everyone poos. Yeah, absolutely. So let's just make sure we get that right. Okay, so how we get the poo sample is the next bit. So why don't we go to the toilet and use our pretend poo to show how we do that?
Perfect.
Before and after collecting your sample, wash your hands.
Okay, so here we are at the toilet.
Yes.
So talk me through, how do we get our poo sample?
Okay, so what we'd do is, if you're able to, you would take some toilet roll in your hand and you would layer it in your hand, and while you're on the toilet having a poo, you would use a toilet roll to catch your poo in.
Okay, let's have a little play at that then. So let's have a pretend. So I'm needing my poo. It's me who's got to have my sample.
Yep.
Obviously, I'm not going to drop my trousers for the video, but usually I'd obviously drop my trousers, sit down as if I'm going to have a poo. So now I need to get some toilet roll.
So we need to have our kit ready.
Okay.
So that you're not trying to worry about where it is. What you can do is, even if you tip it up, it's not going to fall out.
Oh, okay. That's good.
What we can do is you can lay it down gently.
So if I just put that, so either a stool, here I've got a bath side, so I'm putting it on the bath side, just gently put that on the side, and then the stick, if I just keep it upright until, so now I'm sitting, I do my poo, but before I do my poo I get my toilet roll ready, and then as I can feel my poo's coming out, just catch a little bit on the loo roll. So pretend, this is my pretend poo now, we've caught a bit on the loo roll, and all I have to do is get the stick
and brush along your poo.
Brush along it like that. And catch a little bit on it. Yeah.
So you just get a little bit of the poo on there.
Okay.
And then you would take the brush
So for
It's
now,
on the
can I
side.
just pop it back down like that then?
Absolutely, you
And
can.
then I can get rid of this now,
Yeah.
can't I? So then I can flush that away.
Yeah.
It's all gone. I'm not going to because it's pretend poo
Yeah.
and I don't want to put it down the toilet. But so I've flushed that away. So let's get rid of that. That's all been flushed away. I can wipe my bottom. All done. Then all I do is get this,
Yeah.
pick it up, and then carefully put the lid back in and make sure it clicks shut.
Perfect.
And I'm all done.
Yeah, that's your sample done. Nice.
Fantastic. Now, so that's all great if I can do that. But now somebody's watching this video who's going, there is no way in a million years I am catching my poo on a piece of tissue and I can't do that.
Yeah.
What can we do for them?
So what we can do is if that person contacts us at the Health Liaison team at Hertfordshire County Council,
Right.
we can provide a bowl to be placed in the toilet.
Oh, excellent. And we're going to put a link of how to contact us on
Yeah,
and
yeah.
So if they can't catch it, they can get one
Yeah.
of these.
So this bowl gets placed in the toilet
So we put that in there like that.
and the person, so you would just go for a poo like you
So
normally
again,
would.
same again,
Yeah.
do my poo and let me get the pretend poo. So I've done my poo
Yeah.
in the toilet, but before I wipe my bottom,
Yeah.
I'm going to stand up, yeah,
And take
and then get the sample pot.
Yeah.
So this time I haven't needed to get
No,
it ready
haven't needed
open
to.
yet. So I take it up, lean in and just scrape a bit across the top again.
Yeah,
And then-
perfect.
And what happens, so yeah, that's great. So what happens though, if while I've done my poo, I've got a bit of wee in there as well?
So if there's a little bit of wee in there, what we want to try and do is get the sample from the top of the poo
Okay.
where it's not as wet, where it's not
Okay.
saturated by urine.
Okay.
And
But is it a big deal if it
any
does?
sample is better than no sample.
Okay, so ideally we want a poo that's not sat
Yeah.
forever. You know, it's not an old poo. We want a nice fresh poo
Yeah.
that's not got wee on it.
Yeah.
But at the end of the day, any
It's-
sample is better than no
Yeah.
sample because sending this off could save my life.
Absolutely, it really could save your life. So we'd rather have a sample that's had a little bit of wee on it than nothing at all.
Yeah, and every 2 years, just scrape a little bit of my poo
Yeah.
could be the difference between me living and dying.
Really good.
Fantastic, thank you.
As well as doing the screening, it is always important for all of us to keep an eye on our poos and look for any changes. How do you know if your poo is healthy? What does a healthy poo look like? Why is this important?
But we wanted today to talk about the importance of poo
Yes.
and why it's so important for everybody to know what a healthy poo is and what signs could be both of bowel cancer but also of constipation. Because constipation can be quite significant, can't it?
Absolutely, constipation can kill people. It's a really serious health condition that needs to be taken very seriously if someone is constipated.
Right, okay. And if people don't know what a poo should look like, they may not know they're constipated or they may not realise they've got signs of bowel cancer.
Yes.
Right, okay. So we're going to whiz through what a healthy poo should look like. And these aren't real poos, let's get that straight from the start. These are our pretend poos. So there is something called the Bristol stool chart.
Yes.
So the Bristol stool chart, do you want to just talk through what it does then?
So the Bristol stool chart is a chart that's used to assess how long bowel movements are spent in the bowels.
Oh, right.
So type 1 has typically spent the most time in the bowels and type 7 has spent the least. We would be looking for a healthy poo of about type 3 or type 4.
Okay, so if it's type 1 or 2, that's an indicator of constipation,
Yes,
really, isn't it?
absolutely. So if we're seeing these hard poos, like nuggets of poos, that is a sign of constipation.
Right.
Also, watery poo, very watery poo is a sign of constipation as well.
That's because it's got so blocked
Yes.
that some water is coming
Yeah.
past the blockage,
Yeah.
isn't it? So it can. So, yeah, let's talk through each and then we can come to that. So, first of all, let's look at these. So, like I say, they're fake, so I can hold them. So, if you've got poos that are a bit like rabbit poos, what should you do?
So if you've got poos that are like this, it's really important to make sure that you are getting enough water in your diet.
Yeah.
But speak to someone like a support worker, a doctor or your nurse around
Or you
getting
could go
some
to the
help.
chemist and
You
tell
can,
them that you've
absolutely.
got signs of constipation, couldn't you?
And they can then give you some medication that can help you to pass a poo
Right.
again and to clear yourself out a little bit.
So the next one along looks like a whole poo, like
Yeah.
we'd expect, but actually if you look closely you realise it's just lots of these rabbit poos all stuck together.
Yes.
So that's another sign of really bad constipation, isn't
Yeah,
it?
so again, that would be something that you'd need to go to your GP,
Yeah.
pharmacy, or speak to a carer or nurse around what to do and get some support.
Yeah, because and the reason you die of constipation is because if that just gets more and more blocked,
Yes.
eventually that can actually perforate and go
Yeah.
into your body, can't it?
Yeah.
So that's why
And
it's
that
so
can make you
important.
very, very poorly
Yeah,
when it happens.
yeah, and it can kill you.
Yes.
So the next one, so these are the two we're looking for, aren't
Yeah.
they? So these two, we'd say are healthy
poos.
poos. You
They're
know,
good
it means that you've eaten your food
Yeah.
and it's gone nicely through your system at the right speed and it's coming out the other end nice and cool, in the
Yes.
right speed.
Yeah,
So-
so that's what we'd like as a type 3 or a type 4.
Okay, so they're the ones we're looking for. Then, if it starts getting a bit more sort of sludgy or cow patty and a bit sort of just a splurge of poo, that's when we're thinking, oh, it's going a bit too quickly through the body
Yes.
then, isn't it?
So now having a bit of a runny tummy
Yeah.
can be caused by lots of different things. But again, sometimes it's good to tell people that you're
You
having
need to
a bit
keep
of a,
an eye on it,
Yeah,
don't you? You don't want that
absolutely.
as your normal, you want
No.
these as your normal.
And it's very easy to become quickly dehydrated if these are your poos.
Ah, so you need to drink more
Yes,
water.
absolutely.
Right, okay, because you could think, because they're runny, I should drink less water,
Yeah.
but actually it's more important to drink more water.
Absolutely.
And then finally, we'll tip it up because obviously we don't want to tip it up. This is a runny liquid one.
Yes.
So this is diarrhea. This is full diarrhea. Now that can be either, can't it? That can either mean that you're so constipated and you've got so many of these blocking your bowels that
That it's like an overflowing.
overflow,
Can't get through, yeah.
or it can mean that you're really suffering with a bad tummy ache. You might have food poisoning or
Yes.
something else, and you need to get,
So
make
it's
sure
really
you
important to see
tell
someone
someone.
and tell someone if you are having very, very runny poos.
Okay, that's really, really useful for people to know. Now, what are the signs of bowel cancer, or what could people look out for? What should people always tell someone about?
So if when you wipe after a poo you're noticing any blood in your poo, that's
Right.
something that we really need to let someone know if you're seeing that. It's really important.
So when they wipe, it's worth having a little look
Yes.
to see if there's blood. Don't just think, oh, flush
Yeah.
it. Just have a quick check.
Because
and
it
look
could
for
be
blood.
lots of different things that cause that, but it's better to get help and let a doctor diagnose what's going on.
Rightio. Don't die of embarrassment.
No,
That's the
absolutely
answer, isn't
not.
it? Yeah.
There's no need to be embarrassed. Doctors and nurses and everyone poos. Everyone's used to talking about poo, and it's really important that we
Yeah.
talk about it.
Okay, and what other signs are there?
So abdominal pain, so
Right.
that can be a sign, or
So
a
that's
change.
tummy ache,
Yes,
really bad
so
tummy ache.
If your tummy's
Right, okay.
really, really sore, if there's any changes to your usual pattern, so if you usually go once a day and it's a nice type 3 or type 4, and you know regularly, say if you go in the morning, that's normal for you. If there's something outside of what's normal for you, so you're going more often or your poo is more runny alongside having some tummy pain, that can be a
Right.
sign too.
Okay, so if you suddenly used to go every morning straight after breakfast and I do a poo that looks like this,
Yeah.
and now some days I do that, but other days I go 4 or 5 times a day and they can look like
Yeah.
this, or sometimes they look like that, then you're thinking, hang on, that's not right, it's changed.
Yeah, then it's important to go and see
But some
someone.
people naturally have bowels that go all over the
Absolutely.
place, but if you know what your normal is, if it changes,
So
Tell
monitor
someone.
it for about 3 weeks
okay,
generally,
that's a good
and
idea,
then
right.
if it's still after 3 weeks, it's still changed and it's not normal, it's really important to see somebody.
Right, okay.
The other sign is unintentional weight loss, when you don't mean to lose weight and you're not
Okay.
changed anything about what you're doing, but you're losing weight.
Right.
That can be a sign of bowel cancer, and
That can be a sign of all sorts of health things, actually.
Absolutely.
So we shouldn't, even if we're thinking, oh, this is nice, you shouldn't. You should think, hang on a minute, I'm eating the same foods, I'm doing the same exercise, and I've lost half a stone
Yeah.
without even doing anything. Then you have to think, why?
That's when you need to go
Why?
and see
Okay.
someone.
Right. Okay. That's really helpful. Is that everything? Is that all the things we should look out for?
They're the big signs,
They're the
yes.
big
So
signs.
they're the ones that it's really important to look out for.
Lovely, right. So our final message really is talk about poo.
Yes.
It's not embarrassing.
No.
Everyone does it, and poo can really show what's staying well inside us and not, and we don't want people dying of constipation because they haven't told someone that they've got the wrong poos.
Absolutely.
Fantastic. Thank you very much, Megan.
It's important to tell someone if you spot blood in your poo, if you unexpectedly lose weight, or if you have very runny or very hard poo. Bowel cancer is serious, and it is important to check you don't have it. Make sure you use the screening service when you are asked to do so.
So Megan, final message. Everyone's watched this video now. What is your final message when it's thinking about knowing your poo and keeping an eye on it all the time, and about bowel screening? What would be your final message to people?
So if you are a person with a learning disability, it's so important to do this screening. It would potentially save your life. It's a tiny bit of poo. Please don't be embarrassed to talk about poo. It's so important. No health professional or anyone is going to be embarrassed to talk to you about it.
Absolutely.
It is a difference between you living a healthy life and you either getting poorly or dying from embarrassment.
Yeah, you're dying of bowel cancer because you're embarrassed about giving a sample. We don't want that. And we know that you might not ever get bowel cancer, but you can't know for certain.
So my final message would be, it's really important to remember to check your poo regularly and to monitor if there are any changes. And if you see any signs and symptoms of any of the things we've spoken about today, it's important to get some help. And please don't be embarrassed to get some help. Everybody poos. Please remember to do your screening. It could save your life.
Thank you for watching, and for more information, see the links in the description below this video.